the audio.
No problem. Can you hear me all right, or I'll wait until you give me direction. Thank you. And I'll
Just
mute
1 minute,
myself.
please.
No problem. Pas de problème.
Ok. C'est bon? You can start now, please.
Thank you again. As I said, good morning, everybody. I'm Dr. Keith Martin, the Executive Director of the Consortium of Universities for Global Health, speaking from early morning Washington, D.C. It's a great honor for me to be with you today and to share some thoughts and ideas about what we can do to improve access to surgical care on the African continent. And I have to say that it was very inspiring for me to listen to some of the speakers beforehand. And I think as part of this, as we go forward, although Professor Yangniang Gate asked me to share with you things we could do together, I would turn that around. And I want you to think as we go into the future of what you can share with us at CUGH and what we can do together to be able to achieve this mutual goal. So first, I'd like to thank Professor Yangniang Gate, Dr. Desta, the entire team for putting on this joint conference. A lot of work goes into it, and it's much appreciated. So what I wanted to do is really share with you maybe some practical challenges and some issues and how to overcome them. And then if there are any questions, we can go through that to achieve this goal of addressing and strengthening the surgical ecosystem. So I'll start, and let's see if we can move forward. Control. Okay. So we know that the demand for access to surgical care is not static. It's going to grow, not only as the population grows, but also as we age. So with the non-communicable diseases, pediatric population, obstetrics and trauma, this collection of challenges that are essential or amenable to surgical care in many cases, the demand for this is not going to decline. It's going to grow. In the face of a massive gap in access to surgical care, I think for those of us who are physicians but not surgeons, I think a lot of us, speaking personally, really saw the need for addressing this issue by virtue of the patients that we saw and treated when we were working in African institutions, for those that did not receive care, that did not receive access to known surgical care. And as you saw from one of the previous colleagues, Dr. Anakpoya's really powerful picture of the little girl with a cyanotic, I believe it's a cyanotic pediatric congenital heart deformity before and after. Every child and every person who needs surgical care must have access to this. So here's the fixable tragic gap before us in accessing timely quality surgery. Globally, 5 billion people do not have access to such surgery. There's a gap of 143 million additional surgeries per year that are needed to not only save a life or prevent disability. A huge human cost, but also an incredible economic cost to countries. And of course, on the continent of Africa, 1 out of 1.5 billion people do not have access to quality access to surgery. So what I wanted to talk about is addressing what many of you are talking about, which is the surgical ecosystem. And I find, at least in our global health world, when we talk about access to surgical care, the debate and discussion often revolves around the training of surgeons. And of course, as I think all of you are surgeons in the room and online, you know better than anybody that while that's essential, it is part of an ecosystem of many other skill sets and many other inputs that have to be addressed. And if we only train surgeons and neglect the other aspects of the surgical ecosystem, then we will not be able to achieve that goal providing timely, quality access to surgical care for those who need it. So I wanted to show a couple of pictures for you. When I'm in the continent and I'm privileged to attend conferences or give talks, I usually ask a colleague of mine to take me around the local public hospital. And so this picture was taken this summer. I was giving a talk. I won't name the country or the institution, but this is in a capital city. There's more than 1,000 beds in this hospital, and a surgical colleague took me around. There's 14 OR bays. This is one of only 2 gurneys that can be used to transport patients. The OR bays have only one portable radiology system that works, and it has to be moved to the emerge if a trauma comes in and is required. So in the middle of a surgery, you have to close down, of course, and that portable radiology asset has to be moved. This is the operating room records of that very busy public hospital. And I show these 2 pictures only to remind, and all of you know this, but to remind those of you maybe online who are not well versed in this, that the challenges go beyond simply the training of surgeons, but have to do with this broader area of ecosystem strengthening. So the hospital didn't have access to digital records, which of course is very challenging for them to be able to do a lot of the data, the research, and the patient follow-up that is required. So in strengthening the surgical ecosystem, there's really 5 big parts that I wanted to talk about today. And I said not only the surgeons, but other physicians, the nurses, the lab techs. And I included this line about strengthening the public service. Some of you may know Professor Francis Omaswa from Uganda at AAPCHS. He is also a surgeon, and he's written very powerfully about the need to strengthen the public service in those ministries, those government ministries that are absolutely essential into strengthening the surgical ecosystem. And then not only ministries of health. I have to say, we know in global health, when we bring this up to colleagues, their go-to is to focus on the Ministry of Health, which is important. But all of you know that you've got to also have public works, finance, the environment, and others also, and education also on board if we're able to strengthen the surgical ecosystem. So in many countries, colleagues of mine have shared on the continent that there are these significant gaps within ministries in the public service, in the administrative capacity to be able to deliver those programs that you're all fighting for to be able to strengthen the surgical ecosystem. So I brought this up just for something that is deeply neglected, as Professor Omaswa has shared with us, but it needs attention, because without strengthening that public service, we're going to have very, very deep difficulties for any government to be able to deliver the public programs, deliver the access to surgical care that the public wants. The second part, of course, is infrastructure. And one of the previous individuals around the table asked a very poignant question about supply chains and access to the production of the inputs necessary to enable all of you surgeons to do your job. So I put that in as something for us to talk about in terms of what we need to do to be able to strengthen domestic production, domestic African capacity, to be able to provide the inputs, the strengthening the supply chain necessary for the inputs necessary for a high quality surgical ecosystem. And of course, I put universal health coverage here because even though we may create it, if our patients can't afford it, it's a problem. So this is, again, something that the WHO has powerfully moved forward, and a number of African countries have also done so. But it is something as surgeons and as other medical professionals, we need to get behind the advocacy for this, so our patients can actually afford the surgical care that we hope can come to pass. And finally, long-term, well, penultimately, financing, long-term stable domestic financing to support the surgical ecosystem. And finally, and importantly, and I put this in red because it's really important for us to be able to access domestic political commitments. If the domestic political commitments are not there, of course, it's going to be very difficult for us to be able to advance and work effectively with governments if they're not willing to be at the table. So as a group, we have an opportunity to be able to engage governments in ways that perhaps we have not been able to do in the past. And I do say this with the full acknowledgement that all of you are very, very busy surgeons and have probably no time whatsoever. But there's many of the rest of us and others who can be allies with you to be able to advance this with governments. And so that goes to the area of surgical diplomacy for political engagement. And I think that this is extremely important because all of you who are surgeons, there is nobody better to be able to speak truth to power than those of you who see the consequences of a lack of access to surgical care on a daily basis in the patients that you see. Nobody, whether it's dealing with trauma or whether it's obstetrical complications or the children that you treat, nobody knows this better than you who are on the sharp edge of care. So your voice is powerful, not only from a lived experience, but also from a professional knowledge-based experience. But it needs a network. And I would just strongly encourage that, at least from us at CUGH and our colleagues, and I'll get to some of them in a moment, we're really interested in actually working with you to build out a network of individuals in other medical professions, including our colleagues in nursing, as well as our other colleagues in other medical professions, other associations, our lab colleagues, right? Very important for all of you to do your work. And in fact, some in the private sector who actually in their workforce see the consequences of a lack of access to surgical care. We also have to work and try to identify in our surgical diplomacy which governments are interested in engaging in strengthening the surgical ecosystem. And it has to be done, as I mentioned, across ministries. Yes, we need the Ministry of Health, but we also need the Ministry of Education. And we've got to get the Ministry of Public Works on board, because how are we going to get the water and the power and the supply chains sorted out? And finally, we have to get the Ministry of Finance. I used to be a politician, and the power at the table, as we know, is not the Minister of Health. The Minister of Finance has perhaps, and based on the country, but a lot of power at the cabinet table. So we have to bring in the ministries of finance on board in what we are able to do across governments in an integrated way to strengthen the surgical ecosystem. So what do we need to do? Well, I think some of the things we need to do is work with them to identify what are the gaps within a specific country, and then offer to co-create solutions with them. You, as I mentioned, see the sharp edge. You've got solutions that you can offer. Work with them to be able to do that. Ask for a cross-ministry integrated mechanism to do that, and assist them with that implementation and advice, the professional advice that you can give that they may not well have within their public service. So what's our pitch for action? A lot of the time when these guys talk about this in terms of our global health colleagues, they understandably, we talk about people's lives. We talk about it from an equity issue. We talk about it from a humanitarian purpose. But at a cabinet table, there are other factors at play. And what moves the politicians, as we know, they want to get elected. They want to do what's publicly attractive. And they have budgets to be able to have to manage. And they have a lot of demands on them. So what are some of the pitches we have to support investing, and it is an investment, in the surgical ecosystem? It creates jobs. It improves the economy, saves money, very popular with the public, saves lives and reduces disability. On the other side of the argument is that a failure to act will have the opposite effect. And as I mentioned early on, This is a problem that's going to increase, particularly with the rise of non-communicable diseases, causing 70% of deaths worldwide and the leading cause of disability, and something that impacts low and middle income countries much more than high income countries. So the pitch for action needs to be framed in the political interests, incentives, and context upon which the government you're dealing with. But as I said, bring in not only surgeons, but bring in all of our other colleagues together and other sectors, as I said, by the private sector, to come in and be able to address this with the governments at hand. And don't forget to actually address directly the President or Prime Minister's office, which often holds the final answer to these questions. And I wanted to just, for a moment, just focus on prevention. We often talk about treatment, but as I mentioned before, you on the sharp edge of care, there's a strong argument and a huge need for surgeons and the rest of us who worked in emergency medicine and on the front lines, for us to speak about prevention, about preventing the demand for surgical care, such as in this case, road traffic accidents. We held our first joint conference in South Africa last year with Stellenbosch University. And one of the sessions that we brought together were trauma surgeons along with engineers to talk about the need to address and prevent road traffic accidents, the leading cause of death in young people. So I just put this screen up there just as sort of a reminder that not only on the treatment side, but there's a huge gap for us to be able to work together and work with governments on preventing the demand for surgical care, not only for trauma, but also in NCDs. And there's a lot of work, known interventions that can be done to that end. And there's been great advances, of course, with the West African College of Surgeons, CASEXA, PACS, WHO, Incision, Student Surgical Network. I can go on and on with various universities on the continent, from Stellenbosch to Cape Town, UCT, and others. Many here in the United States, including our colleagues at Harvard University, Drs. Mira, Park, and others who we work with, and at the University of Utah, who colleagues of mine, essentially Dr. Catherine DeVries and Raymond Price, wrote this great book on global surgery and public health. So there's a lot of groups, including the G4 Alliance, that are bringing together our colleagues together in this mission, and of course our group at CUGH, and we have 39,000 global health practitioners around the world and 190 institutions. We hope your institution will join us because we work with G4, we work with African institutions like Stellenbosch and others, and to be able to advance and strengthen the surgical ecosystem. So what are some of the things I'll just share with you shortly in closing is that at CUGH, we run annual global surgery days, bringing together the representatives from the surgical ecosystem in person at our annual conference. And our next one will be in Los Angeles next March. There's the website. Please join us if you can. We held our first regional meeting in South Africa last year, where surgery was featured prominently. We have a partnership with AfriHealth. Now, AfriHealth is a consortium of 70 African institutions based in Kumasi, Ghana, and we work with them in partnership to be able to improve health outcomes. But part of that, of course, is accessing surgical care. And the co-chair of that from our side is Dr. Catherine True, who is a surgeon based in Stellenbosch. So the leadership of this is entirely based on the continent, and we work in many aspects of what we're talking about today. We also held a first a global surgery workshop just a month ago, and these surgery workshops were entirely free for anybody in the world to attend, and we want to do more of them, and would love to do them with you. We also created a capacity building platform, and I put the link there. We worked on this with AfriHealth and with the National Institutes for Health. And this site, and I hope you will share it and use it, is a mechanism for institutions to be able to identify and share their training needs, and also be able to attract trainers. And one of the things we've been working on with AfriHealth is to strengthen relationships and collaborations between African institutions to be able to strengthen the health ecosystem, including the surgical ecosystem. So let's collaborate. Let's find out how we can strengthen training programs, work together, align needs with capacity. And I will say one thing in terms of our advocacy work. One issue was mentioned on the brain drain. Please use us as your ally to be able to address that issue. When I was in Parliament, I put forth motions that if you can't prevent people from going, they're free to go, but you can stop active poaching by high-income countries against low-income countries, which is immoral. So what I put forth in Parliament in Canada was a motion that if you accept somebody from a low-income country in the healthcare field, there's an obligation on the part of that country to train 2 people of equivalent skill set in that country. So 2 for 1. Join the AfriHealth CUGH network, which is multidisciplinary, multi-sector, and involved in capacity building. And please, again, consider coming to our conference in Los Angeles, and please join us in our efforts for advocacy. I'll close with this. We often have at least I have this conversation with colleagues in global health, particularly in academia, some of which who feel that they should not get involved in being political. Now, you don't need to be partisan, but as both Dr. Rudolf Virchow, the father of public health, and Albert Einstein said, essentially, we have to get political. We have to be able to be involved in political affairs, because that's where the rubber hits the road in terms of being able to build the systems, finance the systems, and implement the public programs patients need and people need to be able to prevent and treat and provide the care that they need. So merci beaucoup. Thank you very much for your attention. And please join us, as I mentioned before. We look forward to working with you, and I look forward to actually hearing the guidance that you can give to us in terms of what we can do together to improve access to quality surgical care for everybody on the continent. Merci beaucoup. Back to you, organizer.